Are you struggling with an inguinal hernia and looking for relief specifically through abdominal exercises? Or maybe you have been told that you need to strengthen your core in order to help your inguinal hernia. However, you don't know how to do that because you're also not supposed to put too much stress through your abdominal muscles. If you're confused about how to strengthen your core and do abdominal exercises when you've been diagnosed with an inguinal hernia, then today's video is for you. Join us as we explore the best abdominal exercises for inguinal hernia relief, techniques for strengthening your core safely, and tips for preventing further injury during workouts. Because many people cause their inguinal hernias while they're doing heavy weightlifting. Many people who suffer with an inguinal hernia have pain. It's deep in their abdominals, and you may even feel a bulging over time, especially if that hernia has popped itself out. Now, usually at that point, they'll go to the doctor because that is very concerning when you see something popping out of your abdominals. Feels kind of like aliens sometimes, doesn't it? So they'll go to their doctor and they get diagnosed with an inguinal hernia. And the doctor says something like, well, don't do any core exercises, but make sure you keep your core strong or else you might end up making this problem worse and then even having low back pain. And they don't know what to do because they want to get back to their exercises, which is commonly includes weightlifting, and they don't know how to do that pain-free, as well as they don't know how to strengthen their core or even activate their core necessarily without crunching. And it's that crunching that you're supposed to avoid. So today we're going to discuss specific exercises that you can do that will actually help to strengthen your core, as well as getting it to contract properly without doing that crunching, which can aggravate that inguinal hernia. Now, the first exercise may seem a little silly, especially if you're used to lifting weights that are pretty heavy. And the reason why is many people feel like focusing on breathing and getting your core to contract at the same time is not really worthy of your time. You don't see any big change. However, I posit to you that chances are good that this inguinal hernia was caused by breath holding while trying to lift something heavy in the first place. And therefore, you need to learn how to lift heavy things without causing an inguinal hernia. So we need to get those abs to contract because if you're lifting heavy things, we need that support for the lumbar spine. However, we need to do it along with proper breathing to make sure that we don't increase the abdominal pressure. See, when you're breath holding, and then especially when you lift something heavy, that increases the abdominal pressure, which is what often causes inguinal hernias in the first place. So you may be wondering, what do I do to prevent it from progressing, even though I like to lift heavy weights? This is what you do. You start with this exercise and figure out how to do it laying on the table, and then you implement that into your weightlifting routine. So first, we're going to start with that deep abdominal breathing or that deep belly breathing. It's important not only to activate the diaphragm, which activates the vagus nerve and gets everything to chill out, but it also makes sure we get those abs working appropriately. So first, we're going to start with the deep breathing, then we're going to add in an abdominal contraction. In order to do the deep breathing, you're going to take a deep breath in all the way down to your belly to make a belly bubble. That looks like this. Breathing in through your nose, out through your mouth, like you're blowing out a birthday candle. Now we're going to add in that abdominal contraction as we're breathing out. So you're going to breathe in through your nose and contract your abdominals as you breathe out. Which also helps to improve the exchange of oxygen in the lungs because it really kind of wrings out that last little bit of air in the lungs. So it actually helps to improve your lung capacity as well. So one more time, we're going to breathe in through the nose, blowing out like we're blowing out a birthday candle, contracting those abdominals at the end. Now, I like to have people start by doing this for 10 to 15 breaths. Once you get it really good when you're laying down, you can then do it in sitting. Once you can do it really well in sitting, you can do it in standing, Once you do it well in standing, then you're ready to try it with weightlifting. And when you're lifting weights or anything that's heavy, you want to be breathing out while you're doing the contraction, breathing in while you're doing the relaxation. And this is important, again, so that we don't have too much intra-abdominal pressure, which is what aggravates that inguinal hernia. All right, our next exercise is to get our lower abdominals engaged. Now, a lot of women really struggle to engage their lower abdominals. We're really used to engaging these ones up here, but not necessarily these ones down here. So when I have people do these exercises, I have them put their hands on their lower abdominals so they can feel like if they're getting a contraction. So what you're going to do is you're going to contract those lower abdominals like you're trying to bring your pubic symphysis, which is that bone that's way deep down in there, and you're trying to bring it up towards your sternum, which is that big breastbone right up in here. So that's the tilting motion that you're trying to create. Now, it's actually a very small motion. So I'm going to show you what it looks like in all reality, and then I'm going to accentuate it a little bit so you can actually see what's happening. But in reality, and you're going to watch right down here, because this is where you're going to see the motion. In all reality, when I'm engaging my lower abdominals, it's going to look like this. Which is a very small motion, and you may not be able to see that on this video. Now, if I add in my upper abdominals as well, it looks like this. And that one is easier to see. That's called a pelvic tilt. There we go. So that one's easier to see, this motion through here. But really initially, when we're trying to do a pelvic tilt, especially when we're trying to get those lower abdominals engaged, it really is a small motion. And it's really one that you may not even be able to see, but you are able to perceive. You're able to feel the muscles tightening underneath your hands. And then you can know that it is actually happening. Of course, you can't watch yourself doing a pelvic tilt anyway. But again, just to show you that motion and what it will look like, if I'm engaging my entire abs, I can do that bigger motion. And so it's this tilting here. Now, here's the challenge with this one, is that you can also use your glutes to cause this motion. That looks like this. And it looks very similar to this, which is abdominals. So you got to check yourself and make sure, am I using glutes or am I using abs? And you may need to put one hand here and one hand here. This one on your abs should feel a tightening underneath. This one under here should not feel a tightening at all. And I understand it is a very fine difference between what is actually happening. So pause this video, take a moment, lay down on your bed or lay down on the floor and try this for yourself and see if you can feel that tightening here as opposed to here. Now, if you're frustrated with this and you can't seem to get it, go ahead and walk away for 10 to 15 minutes and come back and try it again. It is worth it to figure out how to do this, because once you figure out how to engage your lower abdominals, it's going to be really easy to find that support during day-to-day activities. Now, for this exercise, I usually recommend doing about 15 to 20 reps. When you can do 20 reps laying on your back and it's easy to do it, then I recommend doing it in sitting and standing and then adding it into your functional activities. But the truth is, you may start to notice that as you're practicing it laying down in a more supported position, you may even start to notice that you're doing it regularly throughout your daily activities. And this is actually perfect, because the whole goal is that you have that proper activation without causing a huge amount of motion through your pelvis. Now, the next exercise we're going to do for inguinal hernia and to get your abdominals working correctly is supine caudal rotation. Now, I love this exercise because not only does it actually get the abdominals working well, but it also activates the lumbar multifidi. The lumbar multifidi are little muscles that are in your spine that help to control joint motion. And this is really important because we want to make sure that the joints are not getting jammed up while you're doing doing big motions like bending forward or bending backwards. So this is a great exercise to not only work on your abdominals and getting them to activate properly, but also to protect your lumbar spine. But word of caution before we start, many people think that doing a small motion is good, then doing a big motion is better. And that is not the case with this exercise. If you try to do a big motion, that could put A, increased stress on the inguinal hernia, but B, it can also cause you to use the wrong muscles when you're trying to do this exercise. So remember, small motion when we're doing this exercise. Okay, to do this, you want to be laying either on a bed or on the floor with your knees bent and your feet flat on the ground. Now you're going to pick which side you want to start with. For now, we're going to start with my left side here. And then that's going to mean that my right abdominals over here are the ones that are going to be activating. So I'm going to bring my knees down towards the left side just until my right hip starts to come off the table. Then I'm going to use the muscles here on the front, those abdominals, to pull that hip back and bring those knees back. So knees go down, hip comes up, hip comes down, knees come back. Knees go down, hip comes up, hip comes down, knees come back. Now with this exercise, you want to do 20 repetitions to one side, and then when you're done with that, you want to do 20 repetitions to the other side. So for this one, my knees go to the right, my left hip comes up, my left hip comes down, my knees go back. My knees go to the right, my hip comes up, my hip comes down, my knees go back. Now friends, it is really important with this exercise that we only do reps to one side and then we do them to the other. I do want you doing both sides, but I don't want you doing it in a tick-tock type of fashion. It can make it difficult to be able to keep the motion pure and activate the proper muscles. Alrighty friends, there you go. The top exercises to do to get your abdominals to activate correctly in order to support you while you're doing your daily activities and exercise. None of these exercises involves that crunching type motion, which will put increased stress on your abdominals and your inguinal hernia. Now this video was made because a comment was dropped in one of my other videos asking for exercises specifically for this. So my question to you is, what questions do you have either after watching this video, or what questions do you have that you would love for me to make a video about? Drop it in the comment section below because I'd love to make a video to help you. Don't forget to boop that like button because it helps the algorithm, and subscribe for more health content.